The mother of a teenager who died during labor at a regional Victorian hospital said she would never set foot in the hospital ever again. Sommer Warren, 18, died when she suffered severe hypertension and a seizure, after being induced at Shepparton's Goulburn Valley, GV, Health in 2014. An inquest into Ms. Warren's death was told how the pregnant woman had swelled up and experienced severe migraines and abdominal pain in the weeks leading up to her death. The inquest heard she had gone to the hospital 6 times in 2 weeks due to concerns for her health, and that the hospital failed to induce Ms. Warren in the 5 days before her death, despite urgent calls from a local doctor. Mother has lost faith in major regional hospital. Lisa Scammell's last memories of her daughter Sommer were of her eyes fluttering and her body seizing up. A teary Ms. Scammell told the inquest how she watched on helplessly as Ms. Warren struggled and deteriorated throughout the day, and felt like she had been abandoned by inconsistent hospital staff. "I remember being told she died and I just wanted to get to her," she said. "All I can remember now is walking into that hospital room and seeing her lying flat on the bed, covered with a sheet up to her chin." Ms. Scammell said she had become obsessed with finding answers and that Sommer's death had ruined her career, relationship and connection with her other 2 daughters. "I will not take my daughters to GV Health if they are unwell or injured. If they need a hospital, I will drive to surrounding areas. I will not set foot in the hospital for any reason," she said. Sommer put her trust in the medical profession, but they weren't listening to her. Doctors disagree on state of health. 4 doctors and medical professors attended the final day of the inquest in Melbourne, but held conflicting views over Sommer's condition and her treatment in hospital. Two obstetricians, Professor Jonathan Haidt and Dr. Bernadette White, did not consider that Sommer met the formal diagnostic features for preeclampsia or eclampsia, and that her obstetric management was reasonable. Obstetric anesthetists Dr. Andrew Ross and Dr. Forbes McGain suspected she did have the disease, and that her anesthetic management should have been handled differently. The doctor said they had been concerned about a 3-minute delay in CPR, after Ms. Warren entered cardiac arrest. Ms. Warren was also administered 50 milligrams of antihypertensive medication, but obstetrician Dr. Andrew Ross said 20 milligrams was the accepted starting dose. Dr. Ross said he did not know why the hospital did not induce Sommer, after local Dr. Rory McKenzie delivered an urgent, handwritten referral to the hospital. In a statement, Dr. McKenzie said the teenager had told him at an appointment, 5 days before her death, that she had received inconsistent advice from different doctors. Sommer informed me that every doctor she saw after Dr. Bao, her initial doctor, told her something different, and at this consultation with me she was agitated and confused, Dr. McKenzie said. Dr. Ross said he did not understand why the hospital had not taken the teen in earlier. Based on my experience, I could see no reasonable reason why they didn't get on with it, Dr. Ross said. I think the consensus here is it wouldn't have been unreasonable to have planned induction earlier. Lack of answers around death. Ms. Warren's former partner Lee Hitchcock said he had been left equally as frustrated by a lack of answers around her death. I think about what happened to Sommer every day. I cannot understand how a young, healthy person can die during childbirth in a large regional hospital. I hope this inquest helps to prevent another family going through what has happened to us. The coroner will hand down findings at a later date. Video: The alarming divide between city and rural health care, 7. "30, contract for Yanning Tuffield." More stories from Victoria.